So, good day everyone. I am Llonard Resurreccion, a student under the School of Industrial Engineering and Engineering Management of Mapua University, taking up Master of Engineering in Industrial Engineering. So, for today, I will be presenting to you the paper that I wrote, which is entitled Assessing the Strengths, Weaknesses, Opportunities, and Threats of Health Management Information Systems in Public Sector Healthcare in the Philippines, a SWOT analysis. So, this is a requirement in the completion of systems engineering course under my program. For today, we will be discussing about the introduction, the literature review, the methods, data collection, results and discussion, and the conclusion concerning the paper. So this study examines the current state of health management information systems in the Philippines and provides recommendations and strategies for improving its implementation and sustainability. The study analyzes the strengths, weaknesses, opportunities, and threats of HMIS in the Philippines using a qualitative research methodology based on documents, published articles, peer-reviewed journals. The findings indicate that HMIS in the Philippines have improved access to healthcare services, increased efficiency in healthcare service delivery, and better patient outcomes. However, challenges such as inadequate infrastructure and resources, technical challenges, and cultural and societal barriers remain. So the study recommends prioritizing the resource allocation and funding for HMIS development, the standardizing interoperability of data systems, training and support for healthcare providers and other stakeholders, promoting awareness and education, and establishing a regulatory framework for data privacy and security. Addressing these challenges and implementing these recommendations can effectively leverage the benefits of HMIS to improve patient outcomes and overall healthcare service delivery in the Philippines. The Philippines healthcare system is currently undergoing significant challenges to address the country's growing population and increasing demand for high quality and you know healthcare services. One of the most significant developments in recent years has been the integration of information systems in healthcare sector, particularly in the public sector. So, the integration of the information systems in healthcare aims to improve the quality and safety and efficiency of healthcare delivery through the use of technology in the public sector. In the Philippines, this integration has led to the implementation of various knowledge management systems or KMIS in public sector healthcare institutions such as the hospitals, clinics, and health centers. KMIS in the public sector healthcare in the Philippines include electronic healthcare records, health information exchanges, systems, and telemedicine platforms and other information systems that facilitate the collection, analysis, and sharing of health data among healthcare providers and patients. So just to have you a picture of what a perfect knowledge management information system is. So a perfect knowledge management information system is a platform that seamlessly integrates technology and healthcare practices to support the effective and efficient management of health information. So, in a perfect knowledge management system, information system rather, healthcare professionals can easily access and share patient information and collaborate with colleagues and make informed decisions in patient care. Moreover, a perfect KMIS should be able to improve the quality and safety of patient care by facilitating evidence-based practice and reducing medical errors. So the system should also be able to enhance the efficiency of healthcare delivery by streamlining administrative processes, reducing wait times, and minimizing duplication of services. So the use of KMIS in the public sector healthcare systems in the Philippines include, of course, just like what I told you, the EHRs and the health information exchange systems. So telemedicines right now are really popular in terms of since the pandemic. Many clinics and other platforms use telemedicine, such is a mobile application where Patients can consult their doctors through their phones and have their prescriptions and other certificates or documents needed are sent by the doctor through their phone. So those are really something that's been going on for a while, especially in our public health sectors, private rather. So for this study, the objectives of this study is to first identify the strengths of health management information systems in the public sector, and of course, determine how these strengths can be leveraged to improve the overall effectiveness of the program. The second one is to identify the weaknesses of HMIS in the public sector and propose strategies to improve these weaknesses to enhance the efficiency and efficacy of the system. The third one is to identify the opportunities for HMIS and develop recommendations on how to seize these opportunities to optimize the use of systems and improve healthcare outcomes. The fourth one is to identify the threats facing HMIS and develop contingency plans to mitigate these threats and ensure the sustainability of the systems. And lastly, to provide insights and recommendations to policymakers, healthcare managers, and other stakeholders to ensure and enhance the performance of HMIS in the Philippines. So the current HMIS used in the industry are not fully optimized to provide the necessary support for healthcare professionals in their decision-making process. So the systems are often inadequate in capturing and sharing knowledge and information, resulting in missed opportunities to improve patient care and outcomes. Moreover, the lack of KMIS in the industry hinders the potential of knowledge sharing and collaboration among healthcare professionals, leading to missed opportunities for innovation and improvement in healthcare delivery. So the industry is facing significant resource constraints such as inadequate funding and skilled human resources to develop and implement KMIS. This limitation results in inadequate technology infrastructure and lack of technical support for the systems, leading to reduced efficiency and effectiveness of the use of the system. Hence, it is essential to identify the strategies that can address these problems and optimize the use of KMIS or HMIS rather in the public sector healthcare in the Philippines. Healthcare is a crucial aspect of any society, and access to quality healthcare services is essential for the well being of the Filipino people. In the Philippines, the public healthcare system faces numerous challenges such as inadequate infrastructure, limited resources, and a shortage of healthcare professionals. One of the areas that require urgent attention is the implementation of our health management information systems in the public sector. According to a recent report, um, by the Department of Health, only 42% of the public healthcare facilities in the Philippines have a functional health management information system. This is a cause for concern because many papers actually have discussed the potential and the possibilities of how knowledge management systems or HM health management systems can improve the quality of healthcare services and promote better health outcomes. So the statistics clearly indicate the need for in-depth analysis of the strengths, weaknesses, opportunities, and strength of threats of the HMIS in the public sector. And by identifying these factors and proposing strategies to address them, this study can provide valuable insights to policymakers, healthcare managers, and other stakeholders on how to optimize HMIS and enhance the performance of the public healthcare in the Philippines. The scope of limit and limitation. The scope of this study is focused on the analysis of the strengths, weaknesses, opportunities, and threats of the health management information systems in the public sector. Study will involve the collection and analysis of data from various resources such as including literature reviews, government reports, and interviews with the stakeholders involved in the implementation and the use of HMIS in the public sector healthcare industry. So, the integration, of course, the integration of health management information systems in the in healthcare has a long history dating back in the early days of electronic medical records in the 1960s. Since then, healthcare systems around the world have evolved to incorporate more advanced technologies, including the use of artificial intelligence, machine learning, and data analytics to improve patient outcomes and reduce costs. Another one is the integration of HMIS into healthcare is seen as a potential solution to some of these challenges. Several studies have conducted and on the challenges and opportunities of HMIS implementation in the Philippines. One study by Martinez et al. Last 2020 identified the several challenges, including data privacy and security concerns, limited resources, and needed for ongoing training and education of health professionals. The study also identified several opportunities, including the potential to improve the management of patient data, enhance communication and collaboration among healthcare professionals, and facilitate evidence based practice. In a study by Nakanishi et al. Last 2021, the authors examined the use of knowledge management information systems in public sector institutions in the Philippines and Indonesia. It is found that these systems can help improve the quality and safety of patient care, as well as enhance the efficiency of healthcare delivery. However, this study also identified several challenges, including the need for adequate resources, the infrastructure to support the implementation, data privacy and security concerns, and the need for ongoing training and education and management of healthcare professionals that will be handling these systems. Quality research is a valuable tool for exploring complex phenomena and is particularly useful when the research topic is not well understood or defined. The exploratory nature of this study requires the collection of data through open-ended interviews, focus group discussions, and of course the document analysis to gain insights on the topic. The exploratory qualitative research methodology is well suited for this study as it allows for a deeper understanding of the research topic. By collecting data through open-ended interviews and document analysis, the study can identify the perspectives of key stakeholders in the healthcare industry and gain insights into their experiences and challenges. So the source of data for this study will be public documents, published articles, and peer-reviewed journals. Public documents such as government reports and policy documents will provide information on the programs implemented by the government and that use and integrate HMIS in public sector healthcare. Published articles and peer-reviewed journals will provide insights into the challenges and opportunities in integrating health management information system in healthcare, as well as the best practices and the success factors for such integration. Now, for the data collected, health management information systems implementation in the Philippines has demonstrated various strengths that have led to the improvement of healthcare service delivery. One of the major strengths of HMIS implementation is its ability to provide real-time data and information on patient care, enabling healthcare providers to make informed decisions about patient diagnoses, treatment, and management. This has led to better patient outcomes, reduced morbidity and mortality rates, and improved overall healthcare service delivery. Another strength of HMIS implementation in the Philippines is the increased efficiency in healthcare service delivery. Electronic health records, EHRs, and other health information technologies have enabled healthcare providers to streamline administrative and clinical processes, resulting in reduced wait times, increased productivity, and cost savings. For example, the use of EHRs in public hospitals has reduced patient waiting times and improved access to healthcare services. Moreover, HMI's implementation has also improved the accuracy and completeness of healthcare data, enabling healthcare providers and policymakers to monitor health trends, track diseases, and plan for public emergencies. For instance, the implementation of the Philippine Health Information System has enabled Department of Health DOH to monitor and control the spread of infectious diseases such as tuberculosis, dengue fever, and pneumonia, and malaria as well. Despite the benefits of health management information systems, there are also weaknesses in existing HMIS in the Philippines that can hinder their effective use. One major weakness is the lack of interoperability between HMIS systems used by the different um, institutions. Different healthcare facilities may use different HMIS technologies, making it difficult to share data and information between the facilities. This can lead to duplicate data entry and inaccurate data, which can compromise the quality of healthcare services delivered. Another weakness is the lack of standardization in the collection of data management. Um, HMIS systems may collect and store data in different formats, making it difficult to compare and analyze data across different facilities and regions. This can hinder information informed decision making and identification of health trend patterns. In addition, there may be a lack of adequate funding for HMIS development and maintenance in some healthcare facilities in the Philippines. This can lead to outdated technology, inadequate training and support for healthcare providers, and limited access to technical assistance and troubleshooting. Moreover, there may be issues with data privacy and security in some systems, and the patient data may be at risk of being compromised or breached. Finally, there may be a lack of awareness and understanding of the benefits of HMIS among healthcare providers and patients. Some healthcare providers may be resistant to using the technology, while patients may be hesitant to share their personal information through the systems. There are several opportunities and strategies that can be implemented to improve the health management information systems in the Philippines. One opportunity is to increase availability and accessibility of mobile technology and internet connectivity, which can improve the efficiency and accuracy of data collection and management. This can be achieved by developing mobile based applications that can be used by healthcare providers to input and access patient data real time, even in remote and underserved areas. Another opportunity is the increased emphasis on data-driven decision-making, evidence-based healthcare practices. HMIS can be used to generate and analyze data to identify health trends and patterns and inform policymaking and resource allocation decisions. This can be achieved by investing data in data analytics tools and developing data sharing agreements between healthcare facilities and agencies. So, to improve HMIS in the Philippines, strategies can be implemented such as standardizing the data collection and management practices across different healthcare facilities and regions. This can be achieved by developing a national HMI standards and guidelines that can be adopted and implemented by different healthcare providers and agencies. Additionally, investment in training and technical support for healthcare providers can be implemented to improve the skills and knowledge of healthcare providers in using HMIS. This can include the training on data collection and management as well as how to use to, data to inform decision making and improve healthcare services. Furthermore, partnerships between government agencies, healthcare providers, and private sector organizations can be established to leverage information and the resources and expertise in HMIS development and implementation. These can include public-private partnerships that focus on developing innovative HMIS technologies and implementing pilot projects in specific regions and healthcare facilities. Lastly, one of the main threats is the lack of adequate funding and resources for HMI's development and implementation. So, apologies if in your screen you're seeing your weaknesses, but we're now talking about the threats concerning the health management information systems. So, the Philippines is a developing country which has limited resources, and is often lack of investment in healthcare infrastructure and technology. So without sufficient funding and resources, it can be challenging to implement and maintain a robust and effective HMIS system. Another threat is the lack of standardization and interoperability of HMIS systems across different healthcare facilities and regions. So the absence of standardized HMIS systems can lead to inconsistencies in data collection and management, as well as hinder the sharing of data between different healthcare providers and agencies. This can limit the potential benefits of HMIS such as data-driven decision making and, of course, resource allocation. Moreover, they may also lead technical challenges by implementing and maintaining HMIS systems, such as hardware and software compatibility issues, system crashes, and data security breaches. Healthcare providers may also provide, facing challenges in using HMIS systems due to the lack of technical skills and knowledge, which can hinder their adoption and use. Finally, there may also be the social and cultural barriers to the adoption of HMIS systems. Patient and healthcare providers may be hesitant to share personal and sensitive health information due to concerns about privacy and confidentiality. So, the successful implementation of health management information systems in the Philippines relies heavily on best practices adopted by organizations. So, these practices ensure that the technology is implemented effectively and efficiently, leading to improved healthcare systems for patients, and one of the best practices implementing HMIS is the establishment of clear goals and objectives. Organizations should have a clear understanding of their goals and objectives before implementing the system, and as this will guide the selection of appropriate technologies and development of a comprehensive plan. Moreover, another best practice is ensuring adequate training and support for healthcare providers. So HMIS technology can be complex, and healthcare providers need to adequately train trained so that they can effectively use the system. So the provision of ongoing support such as troubleshooting and technical assistance is also critical in ensuring the successful adoption and use of HMIS. So the effective communication is another best practice in implementing HMIS in the Philippines. Communication between stakeholders, including healthcare providers, IT professionals, and government agencies, is critical in ensuring the successful adoption and use of HMIS. Clear and consistent communication can help to address concerns, ensure buy-in from all these stakeholders, and promote collaboration and cooperation. So, this also includes, of course, the effective data management, which is also essential in implementing this system. Organizations must have a clear plan for managing and using data collected through the HMIS. The data should be accurate, reliable, and accessible to all stakeholders to ensure informed decision making. So, regular evaluation and monitoring of HMIS implementation are crucial to ensure that the technology is meeting its intended objectives. Regular evaluation and monitoring can help to identify areas for improvement and make necessary adjustments to the system. So, in conclusion, so health management information systems have the potential to revolutionize healthcare service delivery, and particularly the areas of real-time data and information on patient care, improve the efficiency and accuracy in healthcare data. However, several challenges exist, including the lack of interoperability and standardization in data collection, funding for HMIS development and maintenance, data privacy and security concerns, and a lack of awareness of the benefits of HMIS. On the other hand, there are several opportunities, including the availability of mobile technology and internet connectivity, emphasis on data-driven decision-making and evidence-based healthcare practices, standardizing the collection and management practices, investing in training and technical support for healthcare providers, and partnerships between government agencies, healthcare providers, and private sector organizations are also helpful. However, these opportunities are threatened by a lack of funding and resources, technical challenges, and cultural and societal barriers. So, to improve the implementation and sustainability of health management information systems in the Philippines, several recommendations and strategies can be implemented. One important strategy is to prioritize the allocation of resources and funding for HMIS. And of course, this will help address the inadequate infrastructure and limited resources that currently hinder the effective implementation and adoption of the system. Moreover, the standardization and interoperability of data of the systems should be established to ensure seamless data integration and sharing among different healthcare providers. Another key recommendation is to address the technical challenges that hinder the full utilization of HMIS. This can be achieved by providing appropriate training and support to healthcare providers and other stakeholders involved in the implementation and maintenance of the system. Additionally, the integration of innovative technologies such as artificial intelligence and machine learning can be leveraged to enhance the accuracy and efficiency of data collection and analysis. So that concludes my presentation concerning this paper. I really hope that you were able to gather some information to you, and I hope that everyone has a good day. Thank you, and